Hi, good morning. My name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine for individuals, society, and the whole. And occasionally I'll do a topic on myself, which I'm going to do today instead of an interview. And today's topic is going to talk about a patient that had vertigo and dizziness and getting rid of eggs, got rid of it. A very interesting case study. The multifactorial Determinants of Autism by the McCullough Foundation, brain health concerns, vitamin D, probiotics, and migraine headaches. And for those who get my Substack, I do links to articles of interest that review cancer, COVID, and nutritional medicine, integrative medicine topics. So, vertigo. So, I had a 61-year-old patient come in I hadn't seen in about a year, come in for a yearly check for hormones. And when I first met her, she had plantar fasciitis back in 2023, and I do shockwave therapy. And we did that, and it didn't really help, which it normally always helps. And it turns out she had a complete tear down in the fascia, and then eventually she got it repaired, and things got better. But aside from that, she had a whole list of problems, and one of them was severe Meniere's or vertigo, they called it. She was on she had to take lorazepam, meclizine for it to control it, and it would happen all the time. And it was very debilitating. And she had had a long history of urinary problems where she had to take a medication to help her not prevent her from urinating too frequently and overweight. And so a long slew of issues. So anyway, when I do pain management, I don't just do a treatment like shockwave therapy or something like that. I try and get people off food that I think could be sensitive to. So we went through her diet, and she'd had a great relief about a couple years before by going on the blood type O diet, and so she got off a lot of foods, which I'll hallmark when I get people off foods. I take them off dairy, wheat, and eggs, and she was probably eating eggs because that's on the O diet. So anyway, she improved dramatically though on that diet. And then, but she still had these debilitating dizzy spells. To make a long story short, she came in for her yearly checkup, as I said, and she was just on fire with energy and and just life. She showed me her muscles. She was at the gym every day, and she's running two companies. She's been very successful at running one company, and then she took on another company, and it's a type of an AI project that has just taken off. So busy lady, lots of energy, doing well, walking great now, and relatively she doesn't get dizzy spells. So what she did was I said, because it was really a big deal, her getting rid of these dizzy spells. I says, how about the dizzy spells? Have you had any recently? And she goes, no, not really. I've been great. And she says, but I did go on vacation with my family in I think it was Kauai. And she says, yeah, we relax and you have eggs every morning. And all the dizziness started to come back. And so the reason I bring that up is because number one, any symptom, food elimination to me is the most powerful tool in medicine. And when people eat foods every day, they can cause problems, and they might not believe it, they're not told it. And so getting off foods is what I do ever since I started this medicine. And it was because I saw a physician, the very first physician I worked for, he put everybody on kind of a green vegetable puree for 2 weeks. So they were off everything they're normally eating: dairy, wheat, eggs, sugar, processed foods, whatever. And I saw every symptom, literally, illness improve. So I'm always a big food elimination advocate. And in her case, because she got off one food that was really devastating to so many symptoms, that helped her get on a good positive health program where she's lifting weights and exercising and even though she's incredibly busy, she's eating well. So, and that realization stuck in her. And sometimes it's easier when someone has a big hit from one food being eliminated and then reintroduced. That's when it's easy to sell. It's when there's a slow improvement over 2 weeks to a month of a foods or food groups because your gut heals, your microbiome changes. That's a little tougher because then people forget. So that was the first thing. And just remember, food can cause pain, food can cause any symptom. And that's why I'm on day 5 of the Prolon, the fasting mimicking diet. I do this once a month, and I've been doing it for my cancer for that reason, that frequently. My colon cancer that's gone, but I want to keep it gone. Um, and so I recognize, as much as I do this medicine, things that bug me. Coffee's my one. Even a cup a day still gives me a little irritation in a variety of places in my body. So remember, food can cause any symptom, and periodically you should either fast for, if you can do it, 4 or 5 days. The fasting mimicking diet is really a good one because it's so well studied. It's going to put you into ketosis and stimulate autophagy in a very predictable way, and you're off all the classic allergens, dairy, wheat, eggs, and that kind of stuff. So that's one topic. The next topic, Peter McCullough and his McCullough Foundation put out an excellent report on autism. And I have links below where you can download the whole, I forget how many pages it is, but it's a lot. But the diagram at the front and the summary are what's important. So his the biggest push of that document is that there is no one cause to autism. Okay, it's a multifactorial. There are multifactorial determinants of autism, but the elephant in the bedroom may be vaccines. The accumulation of rapid vaccines at young ages, like 32 by the age of 2 years of age, may push over the top, and that's why we have an epidemic of autism. I think it's 1 in 37 people. So anyway, there's a perfect diagram. So when you download that document, you'll see this diagram, and the diagram, it just presents a nice picture of all the things that could be it. There's vaccines, there's a compounded neurotoxicity, there's medications that the mother might have. There's age of the parents and the mother. There's medications, as I said, during pregnancy. If the child has a seizure, high fevers, they're at higher risk. There's environmental toxins. So it's a multifactorial illness. And I remember way back when, I've been doing this a long time, in the early 2000s, I think it was 2001, 2002, I actually heard Andy Wakefield talk about lymphoid hyperplasia in autistic kids, and it was causing tremendous gastrointestinal complaints. It was after the MMR vaccine. And I remember hearing him speak. It was very powerful. And I was at I don't know if this is where I heard him, but it was at the Autism Research Institute's meetings. And Bernard Rimland was a psychologist who had an autistic son, and he found out B6 magnesium helped. And then he got on trying to have these international meetings to find out if there's some kind of biochemical reason. And I remember being at those conferences, and you'd be sitting down, and they had parents and professionals there. And I remember sitting down to these two really educated parents. They're not they're very knowledgeable professionals, and they just said, my child was having frequent infections, which is a common thing that I'll talk about in a moment as a risk factor. And then they got the vaccines, and boom, total change in their child's health overnight. Go to the neurologist, heard the stories many times. Vaccines don't have anything to do with autism. And one of the key things at those meetings was, while they were trying to do the B6 magnesium and diet, was elimination diet, like sugar, dairy products, gluten, wheat products, very similar. One of the things that I recognized is that a lot of these children would have frequent rounds of antibiotics for, I believe, food intolerance triggered symptoms like chronic ear infections, chronic bronchitis, chronic asthma. And when you had a history of chronic antibiotics, especially with added sugar consumption and things like that, many people believe at that time that there was yeast overgrowth. And I still believe that that's part of an issue that can be, well, that was a problem and can be treated. And what happened was that's where the organic acids began to take hold, or kind of got discovered in nutritional integrative medicine. They found out that an organic acid metabolite was spiked in these autistic kids, and then they found out they had a lot of antibiotics and things like that. So that's one determinant. I always look for, in a history, in anybody for that matter, their health during the first 10 years of life. How much antibiotics did they have? Because that can change the gut flora, and that can set you up if that's never dealt with. If you keep eating sugar and then get on alcohol and then get onto all the processed foods, that continues that cycle. And these people have a lot of health issues down the road, autoimmunity, etc. So I highly recommend, you can see the link in the Substack below. You can link up to the Multifactorial Determinants of Autism Spectrum Disorder. And the bottom line was at the end of it is that the rapid introduction in the those early years of life of massive amounts of vaccines, that might push the balance, and that's why we're seeing more. So I look at health as spokes on the wheel, and one of the biggest ones is vaccines. So then I just want to go into my health letter. I put links in there of things I think are interesting in the nutrition, preventive medicine, integrative medicine field, COVID, cancer. But I just want to give a couple of highlights and hope you read through there. So one of them was brain health and oral health. And so there's one study one study that showed that if you were genetically prone to have cavities, missing teeth or bad teeth, you had a 24% increase in the amount of white matter on brain MRIs later on. And then those who had genetically poor oral health, those people had a change in their microstructural they had a 43% change in microstructural damage scores on MRI scans in their brain. So oral health, bottom line is oral health, the brain, you've got oral health and the heart. And then there's one on sleeping. We know this, but you have a lymphatic system in your brain and it cleans it every night. Now, my weakness in my health is I work a lot, I stay up late, study, so I don't sleep as much as I should. So that's my risk factor that I watch for, and I've got to work on getting better at it. But at nighttime, that's when you consolidate memory. That's when the microglia clean house and you have your own lymphatic system. So that's very, very important for good health and cognitive health. And then there was the next one that showed there was another study that was in that Nicholas Holscher had in the Courageous Discourse, and it was a study calling Rising Cognitive Disability as a Public Health Concern Among U.S. Adult Trends for the Behavioral Risk Factor Surveillance System 2013-2023. And it says the disproportionate growth in cognitive disability among younger adults seems to be the primary driver of an overall national trend. These findings warrant further investigations given their long-term implications for population health, workforce productivity, and healthcare systems. So I think of two things. One, that time frame, the last 10 years. All right, so COVID may have accelerated that. The vaccine may have accelerated that, but it was happening before that, the 10 years before that. Is it the relationship to lack of exercise, poor micronutrient dense diets or ultra processed diets, possibly lack of exercise and more in-house, not staying in-house, and now the digital issue, watching the screen. And there's a one called digital dementia. And it says digital dementia, internet generation, excessive screen time during brain development will increase the risk of Alzheimer's and related dementias in adulthood. So there's an article there. And I was so happy. This is just a side story, but I'm so happy when I can get my grandkids out and I take them to the playground, shoot hoops, or do anything with them outside. I mean, that's my goal. Because when we were little, that's what we did for hours and hours every day. We'd just go out. Now, all right, you got your screen. So last week when I went down there, I was just my grandson had his high school buddies over, and he hadn't seen them in a long time, and it was a sleepover. And as I was leaving, they were going to the playground that I always try to do it. They're like 15 and shooting hoops. And I came back and watched him, and he was playing a basketball game, a 5-on-5 in the gym. And I was just like, I was so pumped because we got to get our kids out to run, play, and not behind the screen so much. So the last thing I wanted to go over, or two last things, was there was an interesting article I've done. Migraine headaches. I think food intolerance. I do my elimination diet, which I always do, or fasting. That will help. We know Dr. Moskop, New York Headache Center. I did an article or a substack that's here that intravenous magnesium and oral magnesium, but intravenous magnesium can reduce the migraine headache. So when you do a magnesium assessment, you want to get the RBC magnesium not just above 4, which is the range. You want to get it. I think it's 4.6 to 6.4 or something like that. You want to get it above 5 all the time. So magnesium was something in migraine headaches as a preventive. And then there's also coenzyme Q10. There was high dose riboflavin. There's one herb that I'm thinking of that I can't think of right now, but there was some herbs. But to me, the biggest thing was food elimination and environmental control. But this article, surprisingly, vitamin D pops up again. It's vitamin D and probiotics. And what they did was they gave 50,000 IU of vitamin D every 2 weeks. So that's about 3,500 IU of vitamin D a day. And they followed these people and a probiotic that had 4.5 times 10 to 11 CFU units. And they followed them for 12 weeks compared to a placebo. So that, 12 weeks, that's 3 months. And there was a significant reduction in headaches in the group that took the vitamin D and the probiotics. Vitamin D may have some hormonal effect. Probiotics might have helped the microbiome. That might reduce inflammation coming through the GI tract. And you have less headaches. And then the last part was just a reminder, sexual function, lack of desire, antidepressants, the SSRIs. So there's an article on that. And there's many more articles. I didn't do as many. I didn't go review the ones on COVID. COVID, I call it COVID syndrome. I have a section, but there's always something there on the vaccines issue, which, we shouldn't have those anymore, in my opinion, and many others. And then there's also one on cancers and repurposed drugs that I always cite. So my name is Kirk Hamilton. Look below. There'll be some links below. And you have a great day. And I really encourage you to review the Autism Determinants of Autism by the McCullough Foundation, that link and that publication. Excellent. And until next time, stay and be well.